you know what VA disability is for degenerative disc disease? Let's start with the basics. VA disability through the Veterans Benefits Administration is a benefit program designed to provide financial assistance to veterans who have a disability related to their military service. Now, one of these conditions can be degenerative disc disease. Degenerative disc disease, despite its name, isn't exactly a disease. It's a natural condition that occurs as a part of aging. It involves the gradual wear and tear of the spinal discs, which are the soft, cushion-like pads between the vertebrae of your spine. Over time, these discs can lose their flexibility, elasticity, and shock-absorbing characteristics. What causes it, you ask? Well, there are a few factors. Age is a common one. As we grow older, our spinal discs can start to break down or degenerate. Injuries can also play a part. A sudden fall or accident can cause a herniated or bulging disc, which can then lead to degenerative disc disease. Lastly, lifestyle choices such as smoking or heavy physical work can contribute to the onset of this condition. When these discs start to degenerate, they can cause a variety of problems. They can lead to narrowed spinal canals, which can put pressure on the spinal cord and nerves, causing pain and discomfort. They can also lead to the formation of bone spurs, which are tiny, jagged pieces of bone that can cause pain and stiffness in the back. It's important to understand that having degenerative disc disease doesn't automatically qualify a veteran for VA disability. The VA has a specific rating system in place to determine eligibility and the amount of benefits one can receive. Now that you have a basic understanding of degenerative disc disease and VA disability, let's delve deeper into how the VA rates this condition. To help spread awareness on topics like this to fellow veterans, make sure to hit the like button. So, how does the VA rate degenerative disc disease? Great question. The VA uses a rating system to determine the level of disability caused by this condition. This rating system is based on percentages, with each percentage indicating a different level of disability. Let's start with a 10% rating. A 10% rating is given when the disease causes occasional pain or stiffness. You might have difficulty with certain activities, but overall, you're still fairly functional. In 38 CFR Part 4, a 10% rating is given when forward flexion of the thoracolumbar spine is greater than 60 degrees, but not greater than 85 degrees. Or, forward flexion of the cervical spine is greater than 30 degrees, but not greater than 40 degrees. Or, combined range of motion of the thoracolumbar spine is greater than 120 degrees, but not greater than 235 degrees. Or, combined range of motion of the cervical spine is greater than 170 degrees, but not greater than 335 degrees. Or, muscle spasm, guarding, or localized tenderness not resulting in abnormal gait or abnormal spinal contour. Or, vertebral body fracture with loss of 50% or more of the height. As of 2024, a 10% rating alone pays a single veteran with no dependents $171.23. Next up is a 20% rating, which indicates more frequent pain or stiffness affecting some of your daily activities, making it harder to do certain things or engage in physical activities. In 38 CFR Part 4, a 20% rating is given when forward flexion of the thoracolumbar spine is greater than 30 degrees, but not greater than 60 degrees. Or, forward flexion of the cervical spine is greater than 15 degrees, but not greater than 30 degrees. Or, the combined range of motion of the thoracolumbar spine is not greater than 120 degrees. Or, the combined range of motion of the cervical spine is not greater than 170 degrees. Or, muscle spasm or guarding severe enough to result in an abnormal gait or abnormal spinal contour such as scoliosis, reversed lordosis, or abnormal kyphosis. As of 2024, a 20% rating alone pays a single veteran with no dependents $338.49. Next, a 30% rating indicates more frequent pain or stiffness affecting your daily activities, making it harder to do things like work or engage in physical activities. In 38 CFR Part 4, a 30% rating is given when forward flexion of the cervical spine is 15 degrees or less, or favorable ankylosis of the entire cervical spine is present. As of 2024, a 30% rating alone pays a single veteran with no dependents $524.31. Next, a 40% rating indicates more severe symptoms, such as chronic pain, muscle spasms, or limited range of motion. This can greatly hinder your ability to perform daily tasks and work, and may require you to seek regular medical attention. In 38 CFR Part 4, a 40% rating is given when there's unfavorable ankylosis of the entire cervical spine, or forward flexion of the thoracolumbar spine 30 degrees or less, or favorable ankylosis of the entire thoracolumbar spine. As of 2024, a 40% rating alone pays a single veteran with no dependents $755.28. Next, at 50%, we're looking at additional symptoms like severe muscle spasms causing an abnormal gait or posture. This is a serious rating, indicating that the disease is significantly affecting your mobility, daily activities, and your ability to work. In 38 CFR Part 4, a 50% rating is given when unfavorable ankylosis of the entire thoracolumbar spine. As of 2024, a 50% rating alone pays a single veteran with no dependents $1,075.16. And lastly, a 100% rating is given when the disease has resulted in bedridden status or a need for regular aid and attendance. This is the most severe rating, indicating that the disease has a significant impact on your daily life and needs constant care. In 38 CFR Part 4, a 100% rating is given when there is unfavorable ankylosis of the entire spine. As of 2024, a 100% rating alone pays a single veteran with no dependents $3,737.85. The VA's rating system takes into consideration not only the physical symptoms of degenerative disc disease, but also how these symptoms affect your ability to function in daily life. It's important to note that these ratings are not set in stone. They can change as your condition changes. Understanding the VA's rating system is crucial to making a successful claim. Now, before we talk about secondary conditions, make sure to hit the subscribe button to stay informed and never miss the next videos. Did you know that you can claim secondary conditions to increase your VA rating? Secondary conditions are medical issues that arise as a result of a service-connected condition. In the case of degenerative disc disease, this could include conditions like depression due to chronic pain or a knee problem caused by altered gait. The VA recognizes that these conditions, while not directly caused by military service, are still a result of it. This is why they allow veterans to claim these secondary conditions alongside their primary condition. If these secondary conditions are approved, they can increase your overall VA disability rating. This means that you could potentially receive a higher monthly compensation. The key to successfully claiming secondary conditions is to establish a clear link between them and your primary service-connected condition. Medical evidence is crucial here, so be sure to gather all relevant medical records and doctor's notes. Claiming secondary conditions can significantly increase your VA rating, but how do you make a claim? Making a VA disability claim might seem daunting, but it doesn't have to be. If you're a veteran suffering from degenerative disc disease, you have the right to seek disability benefits. Here's a simplified, step-by-step guide to help you navigate the process. First off, you'll need to gather your medical records. These documents should clearly show your diagnosis of degenerative disc disease and how it affects your daily life. The more detailed, the better. Next, you'll need to fill out and submit a VA Form 21526EZ, also known as the Application for Disability Compensation and Related Compensation Benefits. This form can be found online on the VA's website or at your local VA office. While filling out the form, pay great attention to Section 5, where you'll list all of your disabilities. Be sure to include degenerative disc disease and any secondary conditions that may have developed as a result. After submitting your application, you'll receive a confirmation from the VA, along with information about scheduling your compensation and pension, or C&P exam. This is a crucial step in the process, as it determines the severity of your condition and how it impacts your life. Remember, the VA rates your disability based on how much it interferes with your ability to work or carry out daily activities. So, it's important to be honest and thorough during your exam. If you need help with your claim, don't hesitate to seek assistance. There are many resources available, such as VA-accredited attorneys, claims agents, and veteran service organizations, also known as VSOs, who can help guide you through the process. Lastly, be patient. The VA claim process can take a significant amount of time, but rest assured, your claim is being processed, and you're not alone in this journey. Submitting a claim is just the first step. Now let's discuss what to expect during your C&P exam. After submitting your claim, you'll have to undergo a compensation and pension (C&P) exam. But what exactly does this entail? So the C&P exam is a crucial component of the VA disability claim process. It's a medical examination where a healthcare professional evaluates your condition. They're looking at the severity of your symptoms, how often they occur, and how they impact your daily life. It's important to be honest and thorough during this exam, as the results play a significant role in determining your disability rating. Now let's say you've done the exam and your claim gets denied. Yes, that can feel like a punch to the gut, but it's not the end of the line. The first thing you need to do is to understand why your claim was denied. Your claim notification letter will provide the reasons for the denial. It might say there's insufficient evidence linking your condition to your service, or that your condition isn't severe enough to warrant a disability rating. Understanding these reasons is key to a successful appeal. Speaking of appeal, it's your right to challenge the VA's decision. There are 3 main ways to appeal: requesting a higher-level review, filing a supplemental claim, or appealing directly to the Board of Veterans' Appeals. The best route depends on your specific situation. In a higher-level review, a more senior reviewer re-examines your claim. They look at the same evidence the original reviewer did, but they might interpret it differently. If you've got new evidence that supports your claim, you might want to go with a supplemental claim. Here, you get to present new and relevant evidence that wasn't initially considered. Finally, appealing directly to the board involves a veterans law judge reviewing your claim. You can choose to have a hearing, submit additional evidence, or simply have a review based on the evidence already on record. Claim denials can be frustrating, but understanding the appeal process can make it less daunting. Now, let's talk about support resources. Navigating the VA disability claim process alone can be challenging, but you don't have to do it alone. There are numerous resources out there to support you. VA offices, for instance, offer direct assistance with your claim. They can help clarify the process, answer any questions, and even help fill out your paperwork. Veteran service organizations like the Disabled American Veterans, or DAV, and Veterans of Foreign Wars, or VFW, can also be a huge help. These organizations offer free services to assist veterans in the claim process, from understanding the rating system to submitting an appeal. Online communities are another great support resource to share experiences and advice. Forums and YouTube channels similar to ours provide a platform for veterans to learn and share experiences as well. It's a place where you can find others who've walked in your shoes and can offer guidance. With the right resources and information, you can navigate the VA disability claim process with confidence. Thank you for watching. Please share this video with fellow veterans who will find this video helpful, and check out other videos from us and links that may be helpful to you in the description box below.